Vitamin C, also known as ascorbic acid and L-ascorbic acid, is a vitamin found in food and used as a dietary supplement. The disease scurvy is prevented and treated with vitamin C containing foods or dietary supplements. Evidence does not support use in the general population for the prevention of the common cold. There is, however, some evidence that regular use may shorten the length of colds. It is unclear if supplementation affects the risk of cancer, cardiovascular disease, or dementia. It may be taken by mouth or by injection. Vitamin C is generally well tolerated. Large doses may cause gastrointestinal discomfort, headache, trouble sleeping, and flushing of the skin. Normal doses are safe during pregnancy. The United States Institute of Medicine recommends against taking large doses. Vitamin C is an essential nutrient involved in the repair of tissue and the enzymatic production of certain neurotransmitters. It is required for the functioning of several enzymes and is important for immune system function. It also functions as an antioxidant. Foods containing vitamin C include kale, citrus fruits, broccoli, Brussels sprouts, raw bell peppers, and strawberries. Prolonged storage or cooking may reduce vitamin C content in foods. Vitamin C was discovered in 1912, isolated in 1928, and in 1933 was the first vitamin to be chemically produced. It is on the World Health Organization model list of essential medicines, the most effective and safe medicines needed in a health system. Vitamin C is available as a generic medication and over-the-counter drug. In 2015, the wholesale cost in the developing world was less than 0.01 per tablet. Partly for its discovery, Albert Szent-Györgyi and Walter Norman Haworth were awarded 1937 Nobel Prizes in Physiology and Medicine and Chemistry, respectively. Biology. Significance. Vitamin C is an essential nutrient for certain animals including humans. The term vitamin C encompasses several vitamins that have vitamin C activity in animals. Ascorbate salts such as sodium ascorbate and calcium ascorbate are used in some dietary supplements. These release ascorbate upon digestion. Ascorbate and ascorbic acid are both naturally present in the body, since the forms interconvert according to pH. Oxidized forms of the molecule such as dihydroascorbic acid are converted back to ascorbic acid by reducing agents. Vitamin C is a cofactor in at least 8 enzymatic reactions in animals important in many essential functions, including wound healing. In humans, vitamin C deficiency compromises collagen synthesis, contributing to the more severe symptoms of scurvy. More generally, the biochemical role of vitamin C is to act as an antioxidant by donating electrons to various enzymatic and non-enzymatic reactions. Doing so converts vitamin C to an oxidized state, either as semi-dihydroascorbic acid or dihydroascorbic acid. These compounds can be restored to a reduced state by glutathione and NAD-dependent enzymatic mechanisms. In plants, vitamin C is a substrate for ascorbate peroxidase. This enzyme utilizes ascorbate to neutralize toxic hydrogen peroxide by converting it to water. Biology. Deficiency. Scurvy is a disease resulting from a deficiency of vitamin C, since without this vitamin, collagen made by the body is too unstable to perform its function. Scurvy leads to the formation of brown spots on the skin, spongy gums, and bleeding from all mucous membranes. The spots are most abundant on the thighs and legs, and a person with the ailment looks pale, feels depressed, and is partially immobilized. In advanced scurvy there are open, suppurating wounds and loss of teeth and, eventually, death. The human body can store only a certain amount of vitamin C, and so the body stores are depleted if fresh supplies are not consumed. The time frame for onset of symptoms of scurvy in unstressed adults on a completely vitamin C-free diet, however, may range from 1 month to more than 6 months, depending on previous loading of vitamin C. Notable human dietary studies of experimentally induced scurvy have been conducted on conscientious objectors during World War II in Britain and on Iowa State prisoners in the late 1960s to the 1980s. These studies both found that all obvious symptoms of scurvy previously induced by an experimental scorbutic diet with extremely low vitamin C content could be completely reversed by additional vitamin C supplementation of only 10 mg a day. In these experiments, there was no clinical difference noted between men given 70 mg vitamin C per day and those given 10 mg per day. Men in the prison study developed the first signs of scurvy about 4 weeks after starting the vitamin C-free diet, whereas in the British study, 6 to 8 months were required. possibly due to the preloading of this group with a 70 mg/day supplement for 6 weeks before the scorbutic diet was fed. Men in both studies on a diet devoid, or nearly devoid, of vitamin C had blood levels of vitamin C too low to be accurately measured when they developed signs of scurvy, and in the Iowa study, at this time were estimated to have a body pool of less than 300 mg, with daily turnover of only 2.5 mg/day, implying an instantaneous half-life of 83 days by this time. Uses. Vitamin C has a definitive role in treating scurvy, which is a disease caused by vitamin C deficiency. Beyond that, a role for vitamin C as prevention or treatment for various diseases is disputed, with reviews reporting conflicting results. A 2012 Cochrane review reported no effect of vitamin C supplementation on overall mortality. It is on the World Health Organization's list of essential medicines as one of the most effective and safe medicines needed in a health system. Uses. Scurvy. The disease scurvy is caused by vitamin C deficiency and can be prevented and treated with vitamin C-containing foods or dietary supplements. It takes at least a month of little to no vitamin C before symptoms occur. Early symptoms are malaise and lethargy, progressing to shortness of breath, bone pain, bleeding gums, susceptibility to bruising, poor wound healing, and finally fever, convulsions and eventual death. Until quite late in the disease the damage is reversible, as with vitamin C repletion. Healthy collagen replaces the defective collagen. Treatment can be orally or by intramuscular or intravenous injection. Scurvy was known to Hippocrates in the classical era. The disease was shown to be prevented by citrus fruit in an early controlled trial by a Royal Navy surgeon, James Lind, in 1747, and from 1796 lemon juice was issued to all Royal Navy crewmen. Uses. Infection. The effect of vitamin C on the common cold has been extensively researched. The earliest publication of a controlled clinical trial appears to be from 1945. Researchers continued to work on this question, but research interest and public interest spiked after Linus Pauling, two-time awardee of the Nobel Prize, started publishing research on the topic and also published a book Vitamin C and the Common Cold in 1970. A revised and expanded edition Vitamin C, the Common Cold and the Flu was published in 1976. A Cochrane review published in 2013 with inclusion criteria limited to trials that called for at least 200 mg/day concluded that vitamin C taken on a regular basis was not effective in prevention of the common cold. Limiting inclusion to trials that called for at least 1000 mg/day made no difference. However, taking vitamin C on a regular basis did reduce average duration by 8% in adults and 14% in children, and also reduced severity of colds. A subset of trials reported that supplementation reduced the incidence of colds by half in marathon runners, skiers, or soldiers in subarctic conditions. Another subset of trials looked at therapeutic use, meaning that vitamin C was not started unless the people started to feel the beginnings of a cold. In these, vitamin C did not impact duration or severity. An earlier review stated that vitamin C did not prevent colds, did reduce duration, did not reduce severity. The authors of the Cochrane review concluded that given the consistent effect of vitamin C on the duration and severity of colds in the regular supplementation studies, and the low cost and safety, it may be worthwhile for common cold patients to test on an individual basis whether therapeutic vitamin C is beneficial for them. Vitamin C distributes readily in high concentrations into immune cells, has antimicrobial and natural killer cell activities, promotes lymphocyte proliferation, and is consumed quickly during infections, effects indicating a prominent role in immune system regulation. The European Food Safety Authority found a cause and effect relationship exists between the dietary intake of vitamin C and functioning of a normal immune system in adults and in children under 3 years of age. Uses. Cancer. There are two approaches to the question of whether vitamin C has an impact on cancer. First, within the normal range of dietary intake without additional dietary supplementation, are people who consume more vitamin C at lower risk for developing cancer, and if so, does an orally consumed supplement have the same benefit? Second, for people diagnosed with cancer, will large amounts of ascorbic acid administered intravenously treat the cancer, reduce the adverse effects of other treatments, and so prolong survival and improve quality of life? A 2013 Cochrane review found no evidence that vitamin C supplementation reduces the risk of lung cancer in healthy or high-risk people. A 2014 meta-analysis found that vitamin C intake might protect against lung cancer risk. A second meta-analysis found no effect on the risk of prostate cancer. Two meta-analyses evaluated the effect of vitamin C supplementation on the risk of colorectal cancer. One found a weak association between vitamin C consumption and reduced risk, and the other found no effect of supplementation. A 2011 meta-analysis failed to find support for the prevention of breast cancer with vitamin C supplementation, but a second study concluded that vitamin C may be associated with increased survival in those already diagnosed. Under the rubric of orthomolecular medicine, intravenous vitamin C is a contentious adjunctive cancer therapy, widely used in naturopathic and integrative oncology settings. With oral administration, absorption efficiency decreases as amounts increase. Intravenous administration bypasses this. Doing so makes it possible to achieve plasma concentrations of 5 to 10 millimoles/liter, which far exceed the approximately 0.2 millimoles/L limit from oral consumption. The theories of mechanism are contradictory. At high tissue concentrations, ascorbic acid is described as acting as a pro-oxidant, generating hydrogen peroxide to kill tumor cells. The same literature claims that ascorbic acid acts as an antioxidant, thereby reducing the adverse effects of chemotherapy and radiation therapy. Research continues in this field, but a 2014 review concluded, currently, the use of high-dose intravenous vitamin C cannot be recommended outside of a clinical trial. A 2015 review added, there is no high-quality evidence to suggest that ascorbate supplementation in cancer patients either enhances the anti-tumor effects of chemotherapy or reduces its toxicity. Evidence for ascorbate's anti-tumor effects was limited to case reports and observational and uncontrolled studies. Uses: cardiovascular disease. A 2013 meta-analysis found no evidence that vitamin C supplementation reduces the risk of myocardial infarction, stroke, cardiovascular mortality, or all-cause mortality. However, a second analysis found an inverse relationship between circulating vitamin C levels or dietary vitamin C and the risk of stroke. A meta-analysis of 44 clinical trials has shown a significant positive effect of vitamin C on endothelial function when taken at doses greater than 500 mg per day. The endothelium is a layer of cells that line the interior surface of blood vessels. Endothelial dysfunction is implicated in many aspects of vascular diseases. The researchers noted that the effect of vitamin C supplementation appeared to be dependent on health status, with stronger effects in those at higher cardiovascular disease risk. Studies examining the effects of vitamin C intake on the risk of Alzheimer's disease have reached conflicting conclusions. Maintaining a healthy dietary intake is probably more important than supplementation for achieving any potential benefit. A 2010 review found no role for vitamin C supplementation in the treatment of rheumatoid arthritis. Vitamin C supplementation does not prevent or slow the progression of age-related cataract. Side effects: more than 2 to 3 grams may cause indigestion, particularly when taken on an empty stomach. However, taking vitamin C in the form of sodium ascorbate and calcium ascorbate may minimize this effect. Other symptoms reported for large dose include nausea, abdominal cramps and diarrhea. These effects are attributed to the osmotic effect of unabsorbed vitamin C passing through the intestine. In theory, high vitamin C intake may cause excessive absorption of iron. A summary of reviews of supplementation in healthy subjects did not report this problem, but left as untested the possibility that individuals with hereditary hemochromatosis might be adversely affected. There is a long-standing belief among the mainstream medical community that vitamin C increases risk of kidney stones. Reports of kidney stone formation associated with excess ascorbic acid intake are limited to individuals with renal disease. Reviews state that data from epidemiological studies do not support an association between excess ascorbic acid intake and kidney stone formation in apparently healthy individuals, although one large, multi-year trial did report a nearly twofold increase in kidney stones in men who regularly consumed a vitamin C supplement. Vitamin C is a water-soluble vitamin, with dietary excesses not absorbed, and excesses in the blood rapidly excreted in the urine, so it exhibits remarkably low acute toxicity. Recommended levels. Recommendations for vitamin C intake by adults have been set by various national agencies. In 2000, the North American Dietary Reference Intake chapter on vitamin C updated the recommended dietary allowance to 90 mg per day for adult men and 75 mg/day for adult women, and set a tolerable upper intake level for adults of 2000 mg/day. The table shows RDAs for the United States and Canada for children, and for pregnant and lactating women. For the European Union, the EFSA set higher recommendations for adults, and also for children: 20 mg/day for ages 1 to 3, 30 mg/day for ages 4 to 6, 45 mg/day for ages 7 to 10, 70 mg/day for ages 11 to 14, 100 mg/day for males ages 15 to 17, 90 mg/day for females ages 15 to 17. For pregnancy 100 mg/day, for lactation 155 mg/day. India, on the other hand, has set recommendations much lower: 40 mg/day for ages 1 through adults, 60 mg/day for pregnancy, and 80 mg/day for lactation. Clearly, there is not consensus among countries. Cigarette smokers and people exposed to second-hand smoke have lower plasma vitamin C levels than non-smokers. The thinking is that inhalation of smoke causes oxidative damage, depleting this antioxidant vitamin. The U.S. Institute of Medicine estimated that smokers need 35 mg more vitamin C per day than non-smokers, but did not formally establish a higher RDA for smokers. One meta-analysis showed an inverse relationship between vitamin C intake and lung cancer, although it concluded that more research is needed to confirm this observation. The U.S. National Center for Health Statistics conducts biannual National Health and Nutrition Examination Survey to assess the health and nutritional status of adults and children in the United States. Some results are reported as what we eat in America. The 2013 to 2014 survey reported that for adults ages 20 years and older, men consumed on average 83.3 mg/d and women 75.1 mg/d. This means that half the women and more than half the men are not consuming the RDA for vitamin C. The same survey stated that about 30% of adults reported they consumed a vitamin C dietary supplement or a multivitamin/mineral supplement that included vitamin C, and that for these people total consumption was between 300 and 400 mg/d. In 2000, the Institute of Medicine of the U.S. National Academy of Sciences set a tolerable upper intake level for adults of 2000 mg/day. The amount was chosen because human trials had reported diarrhea and other gastrointestinal disturbances at intakes of greater than 3000 mg/day. This was the lowest observed adverse effect level, meaning that other adverse effects were observed at higher intakes. The European Food Safety Authority reviewed the safety question in 2006 and reached the conclusion that there was not sufficient evidence to set a UL for vitamin C. The Japan National Institute of Health and Nutrition reviewed the same question in 2010 and also reached the conclusion that there was not sufficient evidence to set a UL. Food labeling. For U.S. food and dietary supplement labeling purposes, the amount in a serving is expressed as a percent of daily value. For vitamin C labeling purposes, 100% of the daily value was 60 mg, but as of May 27, 2016 it was revised to 90 mg to bring it into agreement with the RDA. A table of the old and new adult daily values is provided at reference daily intake. Food and supplement companies have until January 1, 2020 to comply with the change. European Union regulations require that labels declare energy, protein, fat, saturated fat, carbohydrates, sugars, and salts. Voluntary nutrients may be shown if present in significant amounts. Instead of daily values, amounts are shown as percent of reference intakes. For vitamin C, 100% RE was set at 80 mg in 2011. Sources. The richest natural sources are fruits and vegetables. Vitamin C is the most widely taken nutritional supplement and is available in a variety of forms, including tablets, drink mixes, and in capsules. Plant sources. While plants are generally a good source of vitamin C, the amount in foods of plant origin depends on the variety of the plant, soil condition, climate where it grew, length of time since it was picked, storage conditions, and method of preparation. The following table is approximate and shows the relative abundance in different raw plant sources. As some plants were analyzed fresh while others were dried, the data are subject to potential variation and difficulties for comparison. The amount is given in milligrams per 100 grams of the edible portion of the fruit or vegetable. Animal sources. Animal-sourced foods do not provide much vitamin C, and what there is destroyed by the heat of cooking. For example, raw chicken liver contains 17.9 milligrams/100 grams, but fried, the content is reduced to 2.7 milligrams/100 grams. Chicken eggs contain no vitamin C, raw or cooked. Vitamin C is present in human breast milk at 5.0 milligrams/100 grams and 6.1 milligrams/100 grams in one tested sample of infant formula, but cow's milk contains only 1.0 milligrams/100 grams. Vitamin C chemically decomposes under certain conditions, many of which may occur during the cooking of food. Vitamin C concentrations in various food substances decrease with time in proportion to the temperature at which they are stored, and cooking can reduce the vitamin C content of vegetables by around 60%, possibly partly due to increased enzymatic destruction, as it may be more significant at sub-boiling temperatures. Longer cooking times also add to this effect, as will copper food vessels, which catalyze the decomposition. Another cause of vitamin C being lost from food is leaching, where the water-soluble vitamin dissolves into the cooking water, which is later poured away and not consumed. However, vitamin C does not leach in all vegetables at the same rate. Research shows broccoli seems to retain more than any other. Research has also shown that freshly cut fruits do not lose significant nutrients when stored in the refrigerator for a few days. Supplements. Vitamin C dietary supplements are available as tablets, capsules, drink mix packets, in multivitamin/mineral formulations, in antioxidant formulations, and as crystalline powder. Vitamin C is also added to some fruit juices and juice drinks. Tablet and capsule content ranges from 25 mg to 1,500 mg per serving. The most commonly used supplement compounds are ascorbic acid, sodium ascorbate, and calcium ascorbate. Vitamin C molecules can also be bound to the fatty acid palmitate, creating ascorbyl palmitate, or else incorporated into liposomes.